This is Radio Health Journal. I'm Nancy Benson. This week, getting up to speed on colorectal cancer.
We're seeing sort of an alarming increase in patients under the age of 50. And several years ago, the American Cancer Society actually lowered the age of screening to 45 from 50, where it had been previously.
Why colon cancer screening is becoming more important when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics, from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I think in the long run, these people are going to disappear, and Dogecoin will fall about 99% lower than it is today. It's just a question of when that's going to happen.
Inside the world of cryptocurrency. Then,
I think there's still kind of a taboo around talking about money, and it's shifting, but we aren't quite there yet.
The touchy conversation of money management. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Around the world, COVID-19 has claimed more than 3 million lives. But health experts say its toll has actually been much higher. Over the last year, many people have avoided getting health care they've needed, either because health facilities have been closed or because patients fear catching COVID. Screening for colorectal cancer is among the tests that's most often skipped.
Certainly dating back to last spring, unfortunately, the screening rates dropped pretty precipitously. There was a time period where, depending on where you are in the United States, a lot of places, and this is what we were doing in the Northeast, we really were just, in terms of procedures, just doing more urgent procedures. So your routine screening colonoscopies, those were put on hold for many months.
That's Dr. James McLean, chief of colorectal surgery at Norwalk Hospital in Norwalk, Connecticut.
We are getting caught up. At this point, we're back to doing routine screenings. I think there's probably also, even though we're back to doing these procedures, there probably is still some concern on patient's part in terms of coming to a facility, you're having a medical procedure done. So I think that is probably also keeping some people away. So COVID-19 definitely has had an effect on the screening of colorectal, and I'm sure other types of cancers as well.
McLean says that's concerning. Colorectal cancer is expected to kill more than 50,000 Americans this year, even though it's extremely curable when caught early.
I can't emphasize the fact enough that the earlier we diagnose colorectal cancer, the better. Cure rates for early stage, like stage 1 and 2, where it's confined to the colon, cure rates and survival rates are up over 90%. Once you start getting into lymph node involvement, it's down more toward 70% or so, 70, 75%. So again, the earlier we find it, then the better chance of curing it.
Experts have been successful getting the message across to people over age 50. About 2/3 of those in the United States have been screened for colorectal cancer. But McLean says a troubling trend has forced a change in recommendations, and many people aren't aware of it.
It certainly is increasing in patients or people under the age of 50. Patients over the age of 50, it's actually decreasing, and that's probably because of increased screening over the last several decades. But again, we're seeing sort of an alarming increase in patients under the age of 50. And in terms of why, we don't know that yet. We haven't figured that out. But that is part of the reason, actually, we're starting to screen people at a younger age. Several years ago, the American Cancer Society actually lowered the age of screening to 45 from 50, where it had been previously, just in recognition of the fact that we're seeing more and more people under the age of 50 with this diagnosis.
People with risk factors should be screened even sooner. African Americans and people with diabetes have a higher risk, and other factors are even more important.
If you have a personal history of polyps, you're at increased risk for colorectal cancer. Now, what are polyps? Polyps are growths that can develop in the lining of the colon, on that inner lining of the large intestine, and these are the precursors to colorectal cancer. Not all polyps will become cancer, but some will. So again, if you have a history of certain types of precancerous polyps, then you're at increased risk. Certain diseases, such as Crohn's disease and ulcerative colitis, which are what we call inflammatory bowel diseases, those patients will have increased chronic inflammation in the bowel, and that's an increase in their risk for colorectal cancer. Family history. So if you have a first-degree relative with a history of colorectal cancer or polyps, that puts you at increased risk as well.
McLean says lifestyle factors may also play a role, and some of those are things people have done more often during the pandemic.
Physical inactivity increases the risk. In terms of diet, we think that red meat and processed meats, such as hot dogs and maybe some luncheon meats, that may increase the risk as well. So if you're not as active or you're eating more comfort foods, sure, that can increase the risk. Now, I think a lot of these things are probably over decades rather than over a few weeks or months. Probably other modifiable risk factors I should mention, smoking and alcohol use as well.
When colon surgeons talk about screening for colorectal cancer, they usually mean colonoscopy. McLean says it's the gold standard because precancerous polyps can not only be seen but removed. And a number of other tests, such as Cologuard, exist to test the stool for genetic changes.
It's a good screening test. Now, again, it's not as good as picking up precancerous polyps, and the understanding is that most people we prefer to sort of diagnose people with polyps in the precancerous stage and remove them, and therefore prevent colon cancer. However, as a simple screening test, it's certainly a good alternative way to start. Screening for colorectal cancer, it's different than even some other cancers. You can actually find the lesions and remove them before they become cancer, as opposed to some other screening strategies for other cancers where you're just trying to find cancer at the earliest stage. With colonoscopy, you certainly can. There is an advantage of finding colorectal cancer at an earlier stage because it's more treatable and more curable. But again, it works best if you're finding them at the precancerous stage and prevent cancer from developing in the first place.
Sometimes doctors are surprised when they do a colonoscopy and find hundreds or even thousands of polyps. McLean says that changes everything.
So if you have thousands of polyps, then obviously you'll sample some of them, but there's no way you're going to remove all of them. And when you have thousands of polyps, that kind of clinches the diagnosis of what we call familial adenomatous polyposis, which is about 1% of patients with colorectal cancer. Those patients have a high likelihood of eventually developing colorectal cancer, even if those 1,000 polyps are all benign at this point. It's almost a given that they're going to develop colorectal cancer by the age of 40 or 50. So the recommendation typically is to remove the entire colon as a prophylactic measure. So we'll do what we call a total proctocolectomy and either hook up the small bowel to the anus or potentially do an ileostomy, which is a permanent bag. But most of the time we're avoiding the bag and ileum to anus anastomosis.
Those cases are extreme. Usually, treatment for colorectal cancer means a mixture of surgery, radiation, and chemotherapy. And these days, it often includes genetic testing of tumors, even if a family history isn't suspected.
In the past, we would just treat patients who clinically met the criteria, maybe multiple family members with colorectal cancer or other types of related cancers, or again, like I said, multiple polyps. But we were finding that we were actually missing a fair number of patients who didn't really fit the textbook definition of those family syndromes. So now we're, for the most part, routinely testing all the biopsies, and then if the biopsies are sort of suspicious for a family syndrome, then we'll send them to a genetic counselor and do the official gene testing. So that has a role. And then finally, we're also doing some gene testing on tumors to potentially dictate treatment. Oftentimes, depending on the mutation in the tumor, that can help guide treatment of metastatic disease or recurrent disease. So it certainly has a role with colorectal cancer like it does for lots of other types of cancers.
With such effective screening, preventing colorectal cancer is a matter of education. If you're over 45 or have risk factors, a colonoscopy should be on your calendar. You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
A new peer-reviewed study shows that California prunes can completely stop bone loss that's common after a traumatic injury. The study adds to a growing body of evidence that prunes are exceptionally beneficial for bone health, stopping bone from degrading and actually helping to build new bone, according to registered dietitian Leslie Bonsi.
California prunes are particularly rich in bone-building minerals. They provide boron, manganese, and also vitamin K, another nutrient that's fundamental for bone formation. Study after study are showing an exciting prune effect on bones, and preliminary results from the largest study yet on prunes show that they may protect bone by reducing inflammatory markers, in study participants.
Evidence from studies on postmenopausal women, on men, and on fracture healing all show how California prunes are a convenient, economical, whole fruit option to benefit bone
Cardiovascular
health.
or CV disease is the number one killer of adults in the U.S., and millions of people trying to reduce their risk of a heart attack or stroke may unknowingly be taking medications that are not proven nor FDA approved to reduce cardiovascular risk. Let's hear from cardiologist Dr. John Osborne.
Many people are unaware that after a failed outcome study, the FDA withdrew the approval of fenofibrate when added to statins as the risk outweighed the benefits to heart health. It's important to remember that statins, along with diet and exercise, can lower cardiovascular risk by about 25 to 35%, but persistent cardiovascular risk, which can lead to a life-threatening event, may remain. I would tell anyone still being prescribed fenofibrate, such as Tricor, Entera, and Trilipix, with a statin, to talk to their doctor about FDA-approved therapies for cardiovascular risk reduction.
To learn more and get clear on the facts, visit itscleartomenow.com. Again, that's itscleartomenow.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more, and check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
A number of the sources I've interviewed say those inspections are essentially staged and don't really reflect the quality, the true quality of the plants overseas.
90% of the drugs we take are generics, and the vast majority come from overseas. How can the FDA make sure they're safe?
Then, researchers explore the link between COVID and kidney function.
The early reports clearly indicate that the kidney is a major target of the COVID-19 virus.
All that and more on Radio Health Journal.